Hello, everybody. So I know there's still a few people moving around, so this is the first session on improving physical and mental health. We have 4 wonderful oral presentations today. Just a little bit of housekeeping to remind people that if you happen to be leaving the room during the Q&A portion of the session, please just be mindful not to be speaking as you're leaving the room. I understand that for you, the session may have finished at that point, but there are people who are still in the room. Just be mindful of everybody's sensory experience. We can, of course, do our best to manage the environment, but we can't manage other people speaking as they leave. So let's just try and be mindful and respectful of that. So the first speaker that we have up is Ilaria Basadonne. I'm sorry if I pronounced that surname incorrectly. Her topic is going to be Inequalities in Accessing Diagnosis and Mental Health Care and Neglected Research Priorities of Autistic People, a participatory quali-quantitative study, and this session will be for 15 minutes, and then I'll introduce the next speakers. Okay, thank you.
Okay, so here we are. I'm sure we all know that autism can be misdiagnosed, lately diagnosed, or not diagnosed at all. And this is particularly the case of women or LGBTQ plus people. And there are barriers, of course, to access the diagnosis, but the studies about this topic are rare. And I'm from Italy, from the University of Pavia, and as far as we know, there are no studies in Italy about this topic. On the other hand, there are discrepancies between the research priorities of autistic people and of us, the research community, let's say, and we have to overcome this gap. And if we don't consider the old perspective, it's possible that we perpetuate stereotypes and that we pass the message that our participants in our studies are guinea pigs, and we don't want this. That's why we created a research group in Pavia at the university, and we are a participatory research group. That means that the group is made of researchers, clinicians, students, neurodivergent, neurotypical, LGBTQ plus or not. So we are very mixed, and we try to cover 3 main aims with this research project. The first one is try to collect information about a potential barrier in accessing diagnosis in autism in Italy. And for that, we developed all together in this participatory research group a questionnaire for the general population that we shared through the internet. And then we wanted to explore the real-life experience of looking for a diagnosis as an autistic person using a qualitative approach. That means that we pose open-ended questions to the people that participate in our project, which are mainly the people that come to our laboratory at the University of Pavia. And this is a laboratory specialized in diagnosis, the autism. And then our third aim is to try to compare the research priorities of professionals in the healthcare system and autistic people, and again, through a quantitative approach using a questionnaire. So, about the first questionnaire about the barriers in addressing diagnosis, we put several social demographic variables as well as aspects of the diagnostic pathway. And we get more than 400 questionnaires completed. But today I will focus on the data from the autistic participants, which were 101 people, and 78 non-autistic people with a mental health diagnosis. So we could find differences in the waiting time for get access to the first assessment and also to get the diagnosis. So the time is longer if you are looking for a diagnosis in autism, at least in our sample. And also the wrong diagnosis. Our autistic participant reported that they had often a wrong diagnosis before getting the right one, let's say. Our participants, as you can see, were mainly females, LGBTQ people, and level 1 request for support. But an interesting aspect related to the Italian context is that in Italy, we have regions, and each region is divided into a province, and half of our participants could get a diagnosis in their province, but they have not. That means they had to go far away from home, or they got a diagnosis through the internet. Other barriers, the age. As you can see, the mean age of our participants when they got the diagnosis is not far from the actual age of this group. That means that there are more attention and interest in assessing autism in adults nowadays, but maybe, and some literature tell us, that autistic people can get a diagnosis and be more sensitive to what's going on in the field and maybe be more prone to fill our questionnaire, for example. Back to the Italian context. So there is a longer waiting time according to the type of service you get access. We have a public service which is very crowded but also cheap, and a private one. Yeah, it depends on your income. If you have a higher income, you tend to get access to the private mental service, and if not, you tend to go to the public. And also in the area, which is very important, in Italy, in the south and center part of Italy, it's rare that you get your diagnosis just at the public services. Then, again, about the lived experience of our participants, we pose these open-ended questions, and we analyze our data using a qualitative approach called consensual qualitative analysis, and we get some categories using the sentences and words that they put in the answers. And we find out that was very important, the diagnosis as a mean to explore themselves and to understand something more about their life, but also interpersonal conditions, interpersonal relationships are very important because they help in reflection about their own experiences and in giving meaning. And yeah, you can see some sentences from our participants. Yeah, another aspect is the role of the clinicians that can, of course, help in getting the diagnosis, or, as in this case, with very positive experiences, but also in this case, they can not offer the right, they cannot listen to the people that come to them. So in this case, they hinder the process. And to conclude, we explored the research priorities from the perspective of the clinicians and our artistic participants. And as you said, can say we have different professionals in our group. And we posed different research topics, maybe compared to the traditional ones, let's say. And we find out that professionals gave less scoring in mental health, diagnostic criteria, and sensory processing, differently from the autistic responders. So to summarize, with this research, we don't have the aim to say that the diagnosis is a very important part of experience as an autistic person, but for some people it's an important step in their life. And in this case, the clinicians must be aware about what this experience means. And on the other hand, the public service should offer the best condition in order to support people that are looking for a diagnosis. So with our research, we are still ongoing. I mean, we are still collecting data, and we hope for the future that we can help improving the situation in Italy and confront with maybe other researchers in other part of the world, and maybe we can help a policymaker to think about better solution in order to guarantee wealth for our participants. So thank you so much for your attention, and I'm here if you have questions.
Thank you so much, Ilaria. Are there any questions from, yeah, there's somebody down on the back left here. Do we have a microphone? Yeah, one's just being brought over to you now.
Hiya. My question is, why do you think that there is a difference between the different areas of Italy with gaining a diagnosis?
Sorry, I couldn't listen. I didn't.
So why do you think there's a difference in the different areas of Italy in accessing a diagnosis? What do you think the reason might be?
Of course, there are many reasons. We can talk about the autism in Italy that can maybe be different and have less or more resources in the north, on the central or the south part. So we are interested in having more data about this aspect to be more able to understand this aspect.
There's a question over here. Sorry, Noreen, to make you get your steps in, the other side of the room. And then I think that will be the last question before we move on to the next speaker.
I was wondering, you said that being part of the LGBTQ community was a barrier to getting the diagnosis. I wondered what was your opinion or your hypothesis on why that happens?
Yeah, I did mention all the data that we got about the LGBTQ participants that we had. I put something in the slide, but yeah, we couldn't find any differences, any effect of being LGBTQ with regard to our participants, because coming from the literature, there are evidence that there are some impact, let's say, or some the importance of this this aspect. But yeah, in our data, we don't have a clear answer for that. And it was not expected, but as you could see, our sample was not so big, and our sample was mainly made of LGBTQ persons, so we should involve more males as well, because we didn't have so many, and yeah, that could be a reason.
Thank you.
We might just take one more question, if that's okay, from the person right at the front, and then we'll definitely move on to the next speaker.
I'm sorry, I just missed the presentation, just joined. I'm so sorry, but regarding the previous question, I have a theory as an LGBTQ person myself. I think it may be, when it comes, for example, in terms of assessment, that LGBTQ plus people tend to mask more. That's my theory, that they became so good at masking that they may not be diagnosed, also because of that. Because they mask as autistic people, they mask as LGBTQ plus people, and they became masters at it. So maybe that's one explanation, at least in my opinion. I don't know what you think about it, but maybe it's something to take into consideration. Thank you.
Yeah, so it's possible explanation from the literature as well. So yeah, for women, that was also the explanation regarding the late diagnosis in women. So that's possible, of course. Yeah.
Thank you so much. Huge thank you to Ilaria. That was very interesting. I think it's interesting to see a lot of the similarities between the access barriers for diagnosis in Italy and Ireland.